Greetings to all of my friends. In this video, I will provide some important facts you should know about depression. Consider subscribing this channel and click the bell button for future update videos. To have a video consultation with me, please join this channel as a member by clicking join button. The reference list using which this video is made is provided in the description section. Depression is a very real and treatable illness, but misunderstandings and stigma continue to be barriers to treatment for many, and the consequences of untreated depression can be life threatening. Understanding the facts about depression, on the other hand, can save lives. In this video, I will provide some things everyone should know about depression and depressive disorders. Depression doesn't always have a good reason. Sometimes people become depressed for what seems like a good reason. Maybe they lost their job or a close friend passed away. But with clinical depression, there doesn't necessarily have to be a reason for how you feel. The chemicals in the brain that are responsible for mood control may be out of balance, causing you to feel bad, even though everything in your life is going well. Many factors can cause depression. Having a parent and grandparent with depression increases the risk of depression, suggesting that genetics play a big role. The rates of depression are also higher among those who have a history of substance abuse. Other factors linked to depression include brain chemistry imbalances, hormones, seasonal changes, stress, and trauma. Depression has been linked to an imbalance in the neurotransmitters that impact mood regulation. This includes dopamine, serotonin, and norepinephrine. The theory is that having too much or too little of these neurotransmitters can cause or contribute to depression. Any flux in the production or function of hormones, for example, during pregnancy, during menstruation, during menopause, or while having thyroid issues, could contribute to depression. Major depressive disorder with seasonal patterns, they are also called seasonal affective disorder, is triggered by disruptions in the circadian rhythm of the body. A change in seasons can also disrupt sleep, which can contribute to a depressed mood. The loss of loved one, trauma and abuse, chronic stress, and big life changes such as a divorce or losing a job can trigger depression. Researchers blame this on the high level of hormone cortisol that are secreted during these stressful traumatic times. Cortisol affects the neurotransmitter serotonin and can trigger depression. Depression is more than ordinary sadness. Sadness is a part of being human, a natural reaction to painful circumstances. All of us will experience sadness at some point in our lives. Depression, however, is an illness with many more symptoms than an unhappy mood. When sadness turns into depression, there are some telltale signs, including changes in appetite, weight, and sleep patterns, decreased sex drive, feeling anxious, hopeless, or helpless, feeling irritable and restless, persistent feelings of sadness or an empty mood, physical symptoms such as headaches, digestive issues, body aches, and pain that doesn't subside with treatment, loss of interest in activities you once enjoyed, now low energy or feelings of fatigue, trouble with concentration, memory, and decision making. Unfortunately, you can't just snap yourself out of depression. If you recognize these signs, seek help from a mental health professional. Children are not immune to depression. A myth exists that says childhood is always a joyful, carefree time in our lives. While children don't experience the same problems that adults do, like work-related stress or financial pressures, this doesn't mean that they can't become depressed. Childhood brings its own unique set of stresses, such as bullying and the struggle for peer acceptance. Depression is a real illness. You are not weak or not crazy. Depression is a real illness that researchers believe is caused mainly by imbalances in certain chemicals within your brain called neurotransmitters. Some experts are even starting to frame depression as a systemic disease. Dopamine helps regulate emotion, memory, thinking, motivation, and reward. Norepinephrine that makes your heart rate and blood pressure soar during a fight or flight response or stressful time. Serotonin, the feel good chemical that helps regulate your mood and plays a role in your overall sense of well being. Researchers are continuing to learn more about what causes these imbalances as well as other neurotransmitters like acetylcholine, GABA, and glutamate, which may also play a role in depression. Depression is treatable. There are several very effective treatment options available for depression, including medications and psychotherapy. In addition, there are new treatments being developed all the time that are proving to be effective in cases where other treatments have failed. While your treatment should be tailored to best suit your symptoms and overall health, a combination of medication, psychotherapy, and lifestyle changes are often used to help alleviate symptoms of depression. Depending on your unique situations, you may participate in individual, group, family, or couples psychotherapy. While there are many types of therapeutic approaches, behavioral activation, cognitive behavioral therapy, interpersonal therapy, problem solving therapy, psychodynamic therapy, social skills therapy, and supportive counseling. These have been study proven to treat depression. In addition to therapy and medication, there are some lifestyle changes that can help you better manage symptoms of depression as well as medication side effects. Here, I provide a few areas to focus on, but first consult your mental health professional to find out if they are right for you. Dieting. There is no cure all diet for depression, but there are certain foods that you can eat and to avoid that play a role in mood and emotional regulation. Processed foods, alcohol, caffeine, sugar, and refined grains can hijack your mental health, while whole foods like fruits, vegetables, fish, chicken, beans, nuts, and seeds can provide mood boosting benefits. A good workout can help lift your mood, reduce stress, and alleviate symptoms of depression. The type of exercise you choose should be based on your fitness level, health, and preferences. Your routine can include aerobic exercises such as jogging, swimming, cycling, brisk walking, elliptical trainer, and mind body exercise like yoga or tai chi. Stress can trigger depression and intensify its symptoms. Long term habits like good nutrition, regular exercise, proper sleep, and meditation build resilience. Incorporate daily stress management techniques once you find what works for you. A support group or mental health professional can provide useful ideas, especially when used in conjunction with psychotherapy. There are many medications that have been found effective in the treatment of depression. Again, since depression treatment is not one size fits for all approach, it may take some trial and error to find the medication that alleviate your symptoms with the fewest side effects. Please consult a psychiatrist for medicines that can manage and cure depressive disorders. Untreated depression is a common cause of suicide. The proper diagnosis and treatment of depression is very important in preventing suicides. If you or someone you love is showing signs of depression, you may wonder what steps to take. You may want to begin by learning more about depression, including symptoms and treatment, as well as myths, misunderstandings, and stigma. This can provide a better picture of what to expect and make you more well informed patient or caregiver. You should also set an appointment with your primary care physician who will give physical exam, run any blood test to rule out any medical conditions that mimic depression, and provide a reference to a mental health professional for further treatment. During the visit, you can also ask for some recommendations or reputable sources of information and support.